Hi, this is Professor Laws and welcome to our video series on caring for patients with infectious respiratory diseases. Now I want to talk about 4 coronavirus diseases and compare the common cold, a GI infection, SARS, and the wicked COVID-19. Now let's take a look again at that coronavirus. This is SARS-CoV-2. That's the one that was recognized in 2019, started in Wuhan, China. Now remember, it's this really big RNA virus, and it's part of a family of coronaviruses. It's the most recent or novel one that's been added to the family. That S protein is the one that we keep reminding you about. It gets the name coronavirus from those spiky proteins that almost make it look like a crown when you look underneath an electron microscope. But the S protein is the one that attaches itself to your cells. So angiotensin converting enzyme 2, or ACE2, is something in your body that expressed by the epithelial cells of your intestines, kidneys, blood vessels, and lungs. Now this is going to come into play when we talk about a GI tract infection because look, you've got ACE2 there. We're going to talk about the respiratory components comparing SARS and COVID-19, and then just the old nasty common cold. So SARS-CoV-2 has a virus, these spiky proteins, and that S protein, I remember S for sticky, it's really good for connecting to ACE2. You've got ACE2 in the epithelial cells of your intestine, kidney, blood vessels, and lungs. But the reason we're likely seeing so much respiratory involvement is because ACE2 is most abundant in your type 2 alveolar cells of your lungs. So that should be easy for you to remember. Now, when this virus wreaks havoc, when we're talking about the one that causes COVID-19 too, then it's COVID-19, I'm sorry. We know that this one decreases the amount of ACE2 in human cells, and that's likely where the lung damage comes from. So we're going to focus on 4 coronavirus diseases, compare the common cold, a GI tract infection, SARS, and what we're seeing as COVID-19. So there they are. Just to give you that framework again, we're going to compare these 4 instances. And remember, COVID-19 is also SARS-CoV-2. Those are the same thing. SARS-CoV-2 is the virus that causes the disease COVID-19. Now, the original SARS is severe acute respiratory syndrome. That's SARS-CoV. Okay, so you've got these 4, and usually what people want to know is, how do I know the difference? Well, it is a little tricky, but I want to break down a comparison for you when we look at these 4 together. Now, first, let's look at the incubation period for these 4. The common cold and GI tract infection are both about an incubation period of 3 days. SARS is a little bit longer, but whoa, look at COVID-19, or that SARS-CoV-2. 2 days to 14 days. So that's a much longer time of incubation. That helps us understand why this is spreading so rapidly, because it hangs around a lot longer. So the incidence of this common cold is pretty regular for most people to get a common cold at least once a season, if not more than once. The GI tract infection portion is rare. So talking about a coronavirus infection of the GI tract, that's pretty rare. SARS, thankfully, today is pretty rare. But COVID-19 caused by SARS-CoV-2 is obviously not rare. From December 19th to March 20th, we have about 500,000 cases, and the numbers were changing every day. So that's just to give you a reference. Common cold, yeah, we don't even track those. GI tract infection, SARS, those are very rare. But the disease caused by SARS-CoV-2 or COVID-19 are prolific, or, as been decided by the World Health Organization, a pandemic. Now, the prognosis. Most people survive a common cold, right? Complete resolution. GI tract infection, you still got, it's rare, but you still have pretty good odds unless it turns into necrotizing enterocolitis, and that is a life-threatening problem or complication. So if they have a GI tract infection, it's very rare. Unless it turns into NEC, then we've got up to 25% risk of not surviving that. SARS, you'll see it's 30% resolve, 70% progress to a severe infection, and for 10% of the people, it's fatal. Now, SARS-CoV-2, the disease COVID-19, there's lots of changing numbers on this, so let's just stop the pin right here, but know that these numbers are changing all the time. So we're thinking about an 80% resolution, 15% severe infection, and then 4.5-ish% could be fatal. Now, I know those numbers don't add up to 100. That's okay when we're talking about this reference, but know that when you compare COVID-19 to a common cold, that's why such drastic measures were taken for social isolation and shutting down non-essential businesses, etc., to try and stop the spread of this disease. So let's look at common cold and GI tract. Let's compare them right next to each other when we're thinking about clinical manifestations. So we've already talked about incubation period, incidence, and prognosis. Now I want you to take a look at the clinical manifestations. Common cold: sneezing, runny nose, headache, sore throat, just feel really tired, fever, and chills. A GI tract infection is a little more socially unacceptable, right? Diarrhea, your stomach's upset, and our neonates are really at risk for neonatal necrotizing enterocolitis. And that's the neck that we were talking about previously. So common cold, very common, right in its name. GI tract infection is very rare. Now let's look at SARS and COVID. When we talk about the clinical manifestations, I wanted you to see the difference. We've already talked about the incubation periods, incidence, and prognosis. Now let's look at the symptoms. SARS has a fever, they're muscle pain, they don't feel good, they have a cough and sore throat, malaise, short of breath, and they can develop a pneumonia. It might be either a direct viral pneumonia from the virus or a secondary bacterial pneumonia because they've been so weakened. In COVID-19, you think of the clinical manifestations in about 3 categories: mild infection, severe infection, and then the severe infection leads to those complications. So mild infection, fever seems to be one that is pretty universal with COVID-19, with this particular coronavirus. That's why places where people gather are making everyone check their temperature. So if they're an essential business or in a hospital, many institutions are insisting, it's mandatory, that everyone check their temperature every certain number of hours, some even as often as upon entry, and every 4 hours. It has to be documented, because if you're developing a fever much over 100 degrees Fahrenheit, then you're expected to remove yourself from that setting because you might be developing this disease. They can have a dry cough, just not feel good, and be kind of dehydrated. But the key common denominator people are using to try to have some data to keep you safe is measuring your temperature. Now, severe infection, the fever is going to get really high. They're going to have significant shortness of breath, even chest pain, and they could be coughing up blood. Now, this severe infection can lead to, you might have a pneumonia, and that pneumonia can progress to ARDS, acute respiratory distress syndrome, and that can lead to sepsis, septic shock, and multi-organ failure and death. Okay, so this is what is taking the patients that are not surviving COVID-19. It's these complications. That virus gets in there, gets a foothold, gets into your cells, decreases the amount of AC2, and you end up with these severe complications. So that wraps up looking at comparing these 4 coronavirus diseases. These are coronavirus infections: common cold, GI tract infection, SARS, and COVID-19. I just wanted to give you a quick overview of the differences of these 4. Now, in other videos, we'll talk about what tests do you run, what diagnostics do you do, but I just wanted you to see the difference between these 4 common and the newest COVID-19 disease that are caused by coronaviruses. Thanks for watching this video with me.